Much for joining today's Family Caregiver webinar. I will be introducing our speaker in just a moment, but my name is Carrie McClellan. I'm the Director of Outreach and Community Engagement for ElderHelp, and I have the pleasure of sharing different topics and educational information with family caregivers during any part of the journey, and we're really fortunate to also partner with Alzheimer's San Diego on many of those topics, as we know so many people are caring for a loved one living with dementia. So I'll introduce Jean in just a moment and the topic, but before I do that, I always like to share just a brief about ElderHelp so that you're familiar with our organization if this is the first time that you're joining a webinar. So our mission at ElderHelp is to provide personalized services and information to help seniors remain independent and live with dignity in their own homes. And of course, that's a journey. You know, sometimes people need more help along the way than others. And during that time, we often are in communication with family members who are caring for their loved ones, whether in town or from afar. So they're always kind of part of that process as well. We are celebrating our 50th anniversary and of supporting the community, and we're really proud of that and look forward to the next 50 years because we know our job is not done. So at ElderHelp, we offer a variety of services. We offer information and referrals to help people understand what resources exist. So that might be ElderHelp's programs, or it might be other community organizations that we connect people to. We offer check-in calls through our Are You OK program, which is great for people who might live alone and maybe need those daily check-ins. We offer nutrition services through our care coordination program, offering grocery shopping assistance as well as a food pantry service. And we offer transportation through our Seniors A Go-Go program, which is where volunteer drivers will help with rides to medical appointments and other destinations. And additionally, in our care coordination program, we connect volunteers with older adults for other services as well, such as friendly visits, minor home repairs, home safety support, and home office organizing, and some mail sorting, those kinds of things, kind of light tasks. And then our housing services team helps with navigating the affordable housing options, as well as offering support through our home share program, which is essentially a roommate matching service. So if you're interested in learning any more about those, our website is a great resource, and I'll make sure to share that with you all afterwards. And I wanted to highlight our family caregiver support. So that's really where these webinars are intended to come through. And I mentioned our information and referral service. So that's available to anybody who is looking for resources. Again, we can point people in the right direction for ElderHelp's programs, but we're often also connecting people with other community organizations. Alzheimer's San Diego is a great resource, Southern Caregiver Resource Center, as well as many others in our community. We also, in addition to these webinars, have created online courses that have really great information, educational information, but also assessment tools and helpful tips for creating a care team, incorporating self-care into your daily routines. And so I encourage anybody who might be interested in checking those out to visit our family caregiver page on our website, and you can access our webinar library there, as well as the online courses. There's 5 different courses, and they're self-paced tutorials, so you can do it at any time of day, whenever it's convenient for you. And now I have the honor of introducing Jean. And Jean is here with us by voice, and so we're so grateful that she's able to join, and she's with the Alzheimer's San Diego team. I'm going to give her a proper introduction. So Jean Alton has worked in the field of Alzheimer's disease and related dementias for over 30 years. She has a bachelor's degree in psychology and in recreation therapy, and is a certified positive approach to care dementia trainer. Jean's expertise is built upon her many years of experience working in a variety of settings, including memory care and facilities, adult social day programs, early memory loss programs, and care management. Jean is a senior dementia educator with Alzheimer's San Diego, where she provides community education and coordinates programs for people with early stage dementia. And I thought that this topic was going to be a good one to start with in January, right after the holidays. Perhaps you have visited your loved ones over the holidays and you're starting to notice some changes, or maybe you live in the same area, see your loved one all the time, and are starting to notice those changes as well. So I just thought it would be a great place to start for the new year. And so Jean, welcome. I'm so happy that you're able to join and share your expertise with us today.
Thank you so much for the kind introduction, Carrie. And yes, I'm happy to be here too. So our topic today, how to talk about memory loss. And this is actually, I think, a perfect one for the start of the year. And we'll delve into it in more detail, but kind of starting those conversations about memory loss can be very challenging. So we'll go to the first slide, please, Carrie.
Very good. And as I transition to the next slide, just a reminder, if anybody has any questions that you'd like to ask, feel free to type them into the question pane. It might say questions or it might say chat, but we will go through those once Jean is done with the presentation. So we're happy to answer questions at the end.
Okay, so sort of our goals here for today is to understand the common causes of memory loss and their consequences, and then to work on how we need to develop our skills for communicating effectively with a person with memory loss. And really, we're going to narrow in on specifically starting those conversations, which can be difficult. And then we'll round things out with looking at some resources for additional support. So we'll go to the next slide. So the first question is, why is it so difficult to talk about memory loss? And I think if we all sit down and think about it for a minute or jot some reasons down on paper, we can come up with all sorts of different answers. But a few might be common amongst a lot of people is, in spite of the changes that certainly I have seen over my career in terms of being able to talk more easily and readily about diseases like dementia and like Alzheimer's disease, there's still some stigma and some shame and some discomfort around these topic areas. And, as far as stigma goes, I'll say I think that's the area I've seen the greatest change over the course of my career, because we have a much better and broader understanding of, what Alzheimer's disease and lots of other dementias are all about. And to know that it's not a part of normal aging, and to also understand that it's not contagious. We don't catch it from other people. And, just through media and community and all sorts of other things, social media and news media and talking with friends and families and community members, we've become much more open about it. But having said that, there still can be some real discomfort talking about it. And along with that discomfort is some myths and misunderstandings that people still have today. And then we just round out that, why is it so difficult to talk about it, with lack of perspective, lack of information, and general fear. And fear is one I think we can all identify with. And I've often said, working at Alzheimer's San Diego doesn't preclude any of us as staff from not having fears about developing a type of dementia like Alzheimer's disease. When my memory is not performing so well, which it's doing a little more frequently as I'm getting older, I definitely have my own moments where I wonder and worry, am I in the early stages of Alzheimer's disease? So I think in starting these conversations, we have to acknowledge just these different factors that are are affecting our ability to talk freely about it. And I think in acknowledging them, that gives us more freedom. It kind of lightens the load of having these kinds of worries and allows us to share those kind of thoughts and feelings a little more freely. So let's go on to the next slide here, Carrie. So there's all sorts of areas of memory loss that can be hard to talk about. And in breaking that down a little bit, we can look at what are some new changes in memory or function that either we're noticing in somebody we care for or perhaps in ourselves. And, then when we start kind of going down that road of, well, I'm concerned that there's something going on with me or with mom or with my husband, then we lead ourselves into other areas of concern and areas that need to be, examined and talked about. And that might be seeking a diagnosis. That could ultimately mean bringing some outside assistance into the home. None of us are, excited and happy to necessarily do that, to bring in care into the home, particularly as we're getting older. And, we all like to be independent and be able to do things on our own. So that's a big one, talking about bringing outside assistance into the home. And then if we have to start considering residential care or some other community-based services, in other words, talking about living in a care facility, a memory care facility, that's a whole other topic that is difficult too. When we think about memory loss and how it ultimately affects driving, that's another big topic area that can be very challenging for families to negotiate. And there's also sharing news about a diagnosis. Do we share the news or do we not? What's our level of comfort with that? Do we want others to know? Do we want to talk about it? Or, are we more private people who like to keep things really to ourselves? So these are all areas that cause us to think a little bit more about them, to worry and wonder a little bit more about them. And all of these areas require further discussion with kind of those that are in the know and the close circle, the family, the support system. So let's go on. I'm going to give you a brief overview of some common symptoms of memory loss, okay? So what we're talking about here is with dementia, which is a broader word that we use to describe many different diseases and disorders that cause dementia. So we're talking about the symptoms. We're seeing changes in memory that disrupts daily life. It's significant enough to disrupt daily life. We're seeing disorientation or confusion, often as to place, but it could be as to time as well too, and sometimes to a person. So in other words, maybe getting lost in a familiar neighborhood, losing track of days, not even so much maybe days of the week, which we can do if we're fairly easily if we're no longer working, but perhaps even months of the year. That even if we lose track of days, all of us should be readily aware of what month we're in, right? And to person, that might be not recognizing somebody who is familiar, maybe not, intimately familiar, but somebody that we should know. So those are some examples of disorientation. We see changes in cognition. So changes in the ability to sequence things, to problem solve, to, organize and carry out tasks and such, in an orderly way, and to be able to get to the end product, to succeed with that problem solving. We also tend to see problems with language, particularly word finding. And we can see some real gaps in communication when we see these changes in cognition. With behavior, we can see some changes to mood or personality, and that's not really at all uncommon with a diagnosis of some type of dementia. And some things that we often see in terms of behavior is withdrawal and loss of initiative, that people are not as socially active as they once were. And, I always say it's like the starter button isn't working. So I'll go back to the old saying, the get up and go has got up and went. So, um, people with dementia often need others to be the initiators of any kind of activity. And then physically, people are having problems completing normal daily tasks. And there can be some significant changes to sensory processing abilities, particularly in the visual field. The visual field can become quite constricted, more narrow. So the peripheral vision, all that information is not being properly received and processed by the brain. So those are some common symptoms of dementia. The next. So as Carrie said, it was Christmas. We get together with people, family, friends, maybe folks that we don't see on a real regular basis. And maybe we see some changes in somebody, as they say, a mom or a dad or a husband or a brother, or maybe people are reporting they see changes in me. And so one of the things that we often stop and check ourselves on is we say, am I overreacting? Is there really anything going on there or not? And I think there's no one kind of right or wrong answer to this, but this is, I guess, what I would say based on my years in this field, is if something is setting off some little alarm bells, in terms of what we're seeing in another person or in terms of what others are seeing happening in us or we are seeing happening in our own selves, that if you're having some questions and thoughts about it, that it warrants looking at it further. And to put the question of, am I overreacting, put it aside for the moment, because when we get some further answers upon investigation into what's going on, our hope is that we were overreacting and there's really no dementia or dementia disease process going on. But we can't know that until we look at things further. So I think if we're overreacting, we're responding to some changes we see that are changes from baseline. So let's look at them further. So the next one, Carrie. Now, in the big picture of things, what is important to consider when we ask those questions, am I overreacting, is we do have to think about safety. Now, not all of these areas are necessarily things we worry about immediately when we see changes in somebody, when we see what seems to be more memory loss in somebody. But keep in mind, these are the things we need to keep in our heads in a broader sense. And that is fall prevention, avoiding injuries and medication errors, abuse prevention, driving, safe driving, firearm safety, kind of in the same vein as driving, caregiver stress, and wandering. Now, for a brief moment, just think about these different areas in terms of if a person is experiencing memory loss, if they are experiencing the symptoms of dementia, if they have those changes physically in the sensory system and their visual field is narrowing, they're at much higher risk for falls. If a person has memory loss, and it's short-term memory loss that we see initially in most people with dementia, how do they keep accurate track of taking medication? Because they may forget to take medication, or they may forget that they took it already. So that's an area that's ripe for safety issues. Abuse prevention, and particularly with regard to financial scams, when people have dementia and it is affecting their ability to use good judgment and problem solve, that makes them more vulnerable to different types of abuse. Both driving and firearm safety requires lots of sequencing, lots of planning and organizing and use of executive function to use good judgment, good reasoning in order to use these things, cars and or guns, in a safe manner. And even if a person has, for goodness sakes, been a driving instructor or a truck driver all their life, or if they've been in the military or a first responder who has, a police officer who's used guns all of their career, that doesn't translate to safe operation of these items when there is dementia occurring, because again, memory is affected, judgment is affected, problem solving is affected. Caregiver stress is a safety consideration because what we see with families is, even in the early stages of memory loss, is the people who are the caregivers or the care partners are already providing more structure, more direction, more cueing, kind of more oversight right from the start of early memory loss to the person with dementia. And over time, those responsibilities increase, the responsibilities of the care partner. And with that goes a tremendous amount of stress. And wandering is a safety consideration because we know that most people with memory loss will wander and become lost at some point in time. So if you're asking yourself, am I overreacting? Pause for a minute and consider safety for that person. And, safety, the safety of the individual and the safety of our community must come before any of our personal discomfort or feelings about these kind of discussions. All right, next one, Carrie. So just briefly, we need to acknowledge also that not everybody who's experiencing memory loss is aware of their memory loss. And it is an actual thing, in fact, has a clinical term. It's called anosognosia. And in a nutshell, it's that people forget that they forget. And so they're basically unaware of their memory loss and their, decrease in cognition, their impaired cognition. They don't have insight into, how this is affecting their life. I'm not taking my medication properly. I'm not driving safely anymore. I've not been paying my bills, and, I'm a danger in the kitchen because I leave pots on the stovetop at, high burner and forget that I've put something on there. So, a large number of people with dementia symptoms fall in that category of not having awareness that they're having issues. And so sometimes when we start to talk to these folks about what we're seeing in them, it gets very difficult because they're saying there's nothing wrong with me. And that's not true, that I'm, having more fender benders. And it's not true that I'm not taking my medication properly. And, I didn't leave the stovetop on high burner. That's not true. And so we get that pushback from these folks because they don't have that insight into their own situation. And then we have other folks who are aware of their memory loss, and it makes them very, very anxious. And so they will acknowledge it, but we see just a lot of anxiety in these folks, and they need a lot of support and a lot of reassurance, and they tend to stay very, very close to their primary care partner because that's their safety zone. And then we have some folks with memory loss who are aware of their memory loss, and they really want to do everything they can to stay in control of their lives and their situation. And so while there may be some acceptance of talking about the memory loss or acknowledging it, there may be less receptiveness to talking about bringing in supports or making some changes in in their life, for example, to quit driving. So we have to go about communicating with these folks in a much different manner, for example, than the other two kind of areas of insight or lack of insight. And because if we go in kind of ready and willing and able to take control of things and get some good safety supports in place, we will likely get pushback from these folks too, because they do want to be the decision maker. They want um, to stay in control of what's going on in their life. Okay, next slide, Carrie. So, what are some skills we can acquire so we know how to communicate with these folks? The next one. So here we go. I mentioned it earlier. Personal and public safety is more important than any one person's emotional state. And that needs to be kind of our guiding philosophy here as we're talking about and dealing with people we care about with memory loss. So next one. So some ways to kind of start the conversations and open it up and to try and do so in a way that's less threatening, perhaps less invasive, more respectful of autonomy, is to acknowledge all the meaning, fears, values, and history of the individual. So, for example, let's say it's a police officer. My brother, the police officer, is experiencing the symptoms of dementia. So, what does having a gun and access to his guns mean to him? And what does it mean to me? Well, to me, I might just see a big safety issue, and maybe I don't have guns in my own home. I'm not comfortable with guns. So I've got a far different view of guns than he does. If he's been an officer all his life and has had all sorts of different training in handling firearms, and in fact, after retirement, continued to go to the shooting range and used several different guns over the course of his life. Guns have a place in his life. They have meaning for him. And I need to stop and think about that and acknowledge that and maybe hear more from him individually as to what it means to him to be able to have access to his guns. And so, rushing in to take those guns away, again, public and personal safety supersedes, whatever personal preferences are. However, we need to acknowledge that in this situation, this example, that guns have played a very important role in this person's life and have a lot of meaning in a lot of different ways. And so what are some ways that we can maybe address the safety issue and yet still allow him to be able to, look at his guns and hold them perhaps? Like, does that mean we have safety locks on all the triggers and that there's clearly no ammunition in the guns and in fact in the home? So is that a way that respects his autonomy in that sense, allowing him to still be able to handle the guns, to hold them, but to not be able to use them. So, and we can think about that in terms of all sorts of different areas. What does living on their own mean to them? What does driving mean to them? What does making their own decisions and being independent mean to them? And we all have different responses to these things, but there's a lot of common threads in there too. And so some of those common threads are these fears of being dependent on others, being a burden to others. We think about getting more isolated. If I have to give up my car because I have to give up driving, I'm definitely going to be more isolated. I will have less social activity. And with many of these safety issues, if we are addressing them and doing things like giving up driving and bringing care into the home, that means a lack of privacy because others are now more involved in our day-to-day life. They know when we're going to the grocery store and what it is we're buying because they're the ones who are taking us there. And lack of privacy and loss of control and autonomy, those are big areas for all of us. None of us feels good when those things are happening. So it's important for all of us to just stop and think about these things as they apply to an individual person. We also have in all of this is cultural values and personal history. And so, we do see and we do know that different cultural values um, result in different situations. So, for example, the family that lives next door to us is a multi-generational family. And so there's a grandmother and mom and dad and a couple of young adult sons, a lot of other family in the neighborhood, and in fact, right across the street. So all very, very involved with one another. So if grandma next door is to develop some type of dementia, she's got a lot of supports there already with the family. Whereas here in my home, it's just my husband and I. We don't have any children. So if one of us develops dementia, we've got an entirely different situation. So we need to stop and think about these things too. All right, next one, Carrie. So when we're talking about memory loss with a person, kind of initiating those conversations, some things to keep in mind that capacity can fluctuate. So, in other words, a person, with memory loss has good days and bad days, just like the rest of us. And some days they may have greater clarity than they do on other days. And so we need to adapt to that and be flexible with that. And if somebody's having a not so good day today, perhaps today's not the day to have some discussions about, for example, those safety issues. Repetition is likely to be required. Why? Because these folks have short-term memory loss. So we may need to kind of repeat things over, talk about concerns, in a gentle way, but we might have to talk about them repeatedly, in terms of, what it is we're seeing and how we think that is impacting their safety and is giving us concerns. We may need some documentation to help with that. And that could be documentation from us, detailing observations or conversations. It could be documentation from others. It could be from the doctor. It could be the doctor saying, my patient, Jean, should no longer drive because of her memory loss, signed Dr. Jones. Maybe when I'm looking for the car keys and wanting to go drive, my husband needs to bring out that documentation from my doctor to give further support and validity to his claims that I am not supposed to drive anymore. We need to do all of this, though, in a compassionate kind of way. And compassionate communication techniques are a real thing. And we have a class actually focused on that. It's called Communication Skills, and I highly recommend it. And we often need to acquire and learn these compassionate communication skills. They don't, I was going to say they don't necessarily come intuitively. I'll amend that. I think they can and do, but we do definitely need to change our styles of communicating with people with memory loss. Some of the things that we do as a part of normal life, such as, arguing with people or trying to use reasoning, those kind of things don't work with folks with memory loss. And then we need to address the issue of self-care. And that's for all of us in all of these things. Self-care, the person who's experiencing memory loss needs to have some focus on self-care. And we, as potential care partners, or maybe we're already involved in a certain level of care, we also need self-care. So let's go to the next one. So how do we prepare ourselves for these conversations? It's good to keep a detailed written record to start, just of observations of what you've maybe seen in yourself or in your husband or in mom or dad. And share those with others and ask others to share their concerns as well too. That's a good way to kind of dial down as to whether I'm overreacting or not, because what are other people saying and reporting? Keep in mind, though, particularly post-Christmas, we often hear from families at Alzheimer's San Diego that, let's say, I'll use myself as an example again, that I live here in San Diego and my mom does too, and I've seen some real changes in mom's memory and cognition. And so we had Christmas here at my house this year, and my siblings came in from out of town. And when I asked them, my siblings, if they were noticing changes in mom, they all said, no, she looks great. She's doing fine. We didn't see any challenges or problems with her at all. So then I'm scratching my head and saying, am I overreacting? Well, perhaps not. Perhaps I need to get feedback from others who know my mom well, who live here in San Diego, who spend regular time with her. So it's not just somebody coming in for a short period of time over the holidays where we have a few get-togethers, but rather people who are involved on a regular basis with mom in her day-to-day life. Because sometimes when we're living from out of town and we come in and it's just a kind of a one-time visit and we see people for a short period of time, we don't see all that there is to see. So, and then do your research first. So when you're talking about memory loss and perhaps needing to look at it further, for example, call us at Alzheimer's San Diego so that we can tell you about the symptoms of dementia, about the diagnostic process, so we can give you information about memory screenings, give you all of that information, that research, so that you can go into these conversations with information to share with others, that you can approach these topics with confidence and you can build your support. And certainly Alzheimer's San Diego and ElderHelp are two of those organizations who that's exactly what we're here for, folks, is to give you support. So next slide. Get the right people to the table. So again, those who, first of all, has the person's best interests in mind, who knows their physical and cognitive status. So they're involved and engaged with the person on a regular basis, and who has the right rapport with the person. So almost every family situation has some family member that means well but is less than helpful, or who comes off as abrasive, or who is sometimes is annoying in the way that they address us and speak to us. And those people are not necessarily the right people to have at the table, at least initially. You want to start with one-on-one conversation for sure. We don't want to have the person with memory loss feeling like they've been ganged up on, right? So we need to go slow, and we need to give ourselves plenty of time and give them plenty of time. And consider your timing, again, in terms of, are they having a good day or a bad day? Is morning a good time for them, or are they pretty sleepy until the afternoon? So think about those things as well. Next slide. Have a plan, and you might work on coming up with the plan with some of your group conversations when you get everybody to the table. Come to some agreement and know what it is you want to accomplish. So what is it? Well, we're concerned about mom. We want to know, does she have some kind of dementia or not? Understand that there may be multiple conversations involved in this roadmap to achieving the plan, that there likely will be multiple conversations needing to happen with a variety of people. Consider decision-making capacity of the person with the memory loss, and also of those who are named as representatives. And know when action is going to be required, and be prepared to do that. And, an example I can tell you, maybe there is in issues of medications. If somebody's not taking medications properly, or driving, or gun safety, those are areas where we may need to take immediate action. So always kind of keep that in the back of your mind as well, too. So next slide. We can make a personal appeal to the person experiencing what seems to be memory loss, particularly with regards to safety issues and/or pursuing diagnosis. I'm worried about your safety. I don't want to let my kids drive with you. Let's talk with your doctor. Please, let's do this for the sake of my peace of mind. I'll go with you. I'll try it too. Yeah, I'll go get a memory screening too. So personal appeals can sometimes make achieving these plans a little easier, a little less threatening. Next slide. So some local and online resources for additional support are us, Alzheimer's San Diego. We have information and referral. Our supportive services team is answering the phones Monday through Friday, 8:30 to 5. And kind of you name it, we can probably give you information about it. We probably have it at hand. Where you get a diagnosis, who are the neurologists in town that we would see. If you want home care or community-based care and support, we've got lists of that. Transportation resources and options, and much, much more. All sorts of disease information, tip sheets on everything from bathing, giving medications, communication skills, all sorts of tip sheets. We also offer, through supportive services, family consultation services. where one of the clinical care coaches can work more individually with a care partner, with family members, to talk about your situation a little more in depth and to help you do some problem solving with any particular situation or challenge you're facing right now. And then through our education, like today, lots of disease information, communication techniques, behavior management, safety, and more. So the next one. And then, of course, here are some others that are all of them .govs or .orgs. And you'll see these are centers that are, kind of the bigger centers, everything from, or organizations, everything from the Alzheimer's Association to the Mayo Clinic. So these are all good websites to go for additional disease information. On the next. There we are again with all of our different programs and services, all of which are at no cost to the community. We are a local independent nonprofit organization, and we have all sorts of different things, support groups. We have a respite program for care partners. We have social activities and outings for those with memory loss and their care partners. Again, our supportive services. We have Vitals, which is volunteers staying in touch with people living alone in the community. We do memory screenings ourselves. And of course, we support local research. So we do all sorts of different things. And let me just conclude by saying, if you feel like you want to kind of start these conversations about concerns about a person's memory loss, reach out to Alzheimer's San Diego and reach out to ElderHelp. These are two organizations that is exactly what we're here for, is to support all of you folks out there in the community and to direct you towards the programs and resources that will best serve you. So either of our organizations are a good place to start, a good place to start leaning on. And, you do want to, if there is some type of dementia that is affecting someone in your circle, your family, your friends, you will need to grow your knowledge over time and grow your skills and grow your supports. So all of these are just more good reasons to contact these organizations, ElderHelp and Alzheimer's San Diego. And so that's what I have for you today. How to talk about memory loss. It can be difficult, it can be challenging, it can make us uncomfortable and feel skittish about it. That's all normal. And, we can help you out with all of that. So please reach out and know that there are good resources and supports for all of you.
Well, thank you so much, Jean, for all of that information. I think it's just really helpful to understand kind of what those initial symptoms might be and also the safety considerations. I thought that was really valuable to remember to think of those safety considerations, and that might help to have those conversations with a loved one and bring it up. So we do have some questions that came through. So I will help with sharing those. The first one is around fall risk and fall prevention. So this particular person asked if there is a script for conversation starters around fall risk. Her dad occasionally says that he's not steady on his feet. He does have a walker, but doesn't use it. Of course, she's suggested grab bars in the shower, but he says they're not necessary right now. And he often will say, I'm fine, I don't need help, don't worry. But she's trying to let him know that he needs these before a fall happens. and he continues to be dismissive. So if you have any suggestions or any tip sheets for conversations around that, that we can
Well,
play
I think this is one of the areas where, you have to think about those 2 points that we talked about is you'll probably need to have multiple conversations with him about this. And so I would just keep at it. And, the other point, you'll probably have to repeat things. And I would stick with that as well, too. But maybe start documenting as well, too. You know, how when he reports a fall to you or if you see one, but also use your powers of observation. If you see scrapes, for example, on his hands or arms or knees, ask about them. And it's could very well be, it seems like there's a good probability that if he's got scrapes on his hands or bruises, skin tears on the hands or the legs, that probably means another fall has happened. And if he's experiencing memory loss, he may not always be reporting those to you. You can also potentially get the doctor involved in this. And in fact, he could, through the doctor, get a referral for an assessment in terms of fall risk, where they're checking a person's balance and assessing the fall risk of the person. And that might be helpful for him to hear that from people other than you as the family member care partner. Sometimes we hear things differently and more readily when it comes from um, professionals or others outside of our inner circle of family and friends. So hopefully that helps.
Yeah, thank you. I definitely think those are some good tips and pointers there. The next question, so this individual's identical twin has Alzheimer's disease, and although she's noticed the changes for the past 5 years, um, the individual's husband finally realized that the changes were happening as of this past May, and the whole family was in agreement. So she is now in a facility. It sounds like she doesn't acknowledge her memory loss, doesn't know why she's there in a new place or where she is. And so this person's asking, how do I talk with her about her memory loss? So it sounds like she's trying to, share pictures and discuss things from when they were growing up. But is there anything else that she can do? They live in 2 different states, and her sundowning has been very bad as well. Do you have any thoughts on or suggestions
Okay.
on how to
Well,
connect?
if the twin is not acknowledging their memory loss at this point in time, I'm not, I would potentially suggest that, doesn't need to be brought up as a topic. Because if the person is in the frame of mind that, I don't have memory loss, there's nothing going on, it doesn't exist, it's not going to be helpful to try and have that back and forth argument or trying to use reasoning with the person. They will believe what they believe. Remember the slide about a lot of people not having insight or awareness of their memory loss. And if that's the place where she's at right now, there's no amount of work on your part is going to convince the twin otherwise. So maybe memory loss doesn't really need to be a part of the conversation. And that could apply also even with like looking at pictures or reminiscing, talking about past times, is you can remove the memory loss from those conversations. And one of the ways you can do that is by not correcting. If you say, oh, here's this picture of us with Uncle Jack, and your twin says, no, that's not Uncle Jack, that was our brother, Rob. Again, think about what's the value in correcting your twin? What's that going to achieve? It's going to achieve nothing but to point out yet again, that there's memory loss going on or changes in cognition. So let it be whatever your twin is saying with regards to reminiscing about family stories, past times, and the same with photographs. Don't worry about correcting. Just be present in the moment and enjoy the conversations, whether they're factual all the time or not. So I'd say now that the person's living in a care facility, just worry less about the memory loss because they're in a safe, secure situation with good oversight, and focus more on just on having those good moments with the person.
Thank you, Jean. Those are definitely good suggestions there. Um, Another question is, how important is it to have an actual diagnosis? This person's doctor has told us that there is mild cognitive impairment currently, but no further referral was given. So should there be something
Well,
more?
that in a sense depends on what type of doctor provided that diagnosis. Generally speaking, we are encouraging families, if there seems to be something going on, you start with the primary care physician for sure. But if a memory screening seems to indicate, yes, there's some changes in memory and cognition, and there's no, in investigating, the primary care physician doesn't find anything else going on, you probably want to seek a referral to a neurologist who's a specialist in areas of memory disorders. And if the family has seen a neurologist and received a diagnosis of MCI, then I would say, mild cognitive impairment is its own diagnosis. It is not Alzheimer's disease. It is memory loss and changes in cognition that are noticeable, but not significant enough to impact daily life. So in that case, just continue with some regular follow-up with the neurologist, which would probably be once a year. If the MCI diagnosis was provided by a primary care physician, there's lots of primary care docs out there who are really good docs, very knowledgeable. And not all of them are specialists and experts in the areas of memory loss. And, I'll just tell you, my primary care doctor, I absolutely adore. She's super smart. I respect her judgment and her opinion. And in spite of that, if she told me I had a diagnosis of MCI, I would get a second opinion because I would want to see a specialist in the area of memory disorders. So I'll leave it at that for you. Diagnosis can be very, very important because we need to know what it is we're dealing with. If a doctor tells us we have cancer, we need to know what kind of cancer and where it is and what stage is it at and what's the prognosis. We need more information.
Thank you. I think that definitely helps there. And then the last question that came in is if there is a similar Alzheimer's organization in Los Angeles.
There sure is. And it's called Alzheimer's Los Angeles. Let me just
Okay.
And they are also a local nonprofit organization, kind of a sister organization to us. We
Okay.
stay in contact with them, and they with us. I'm just pulling it up. Alzheimer's Los Angeles, right? Yep, Alzheimer's Los Angeles.
Okay.
So, and their website is www.alzheimersla.org.
Perfect. Thank you.
And they'll be able to, they'll do much the same things we do, but specific to the LA area.
Wonderful. Thank you so much. Well, those are all of the questions that came in. So thank you all for submitting those. It's always the perfect time to get your specific questions answered and to find out, if there's any suggestions that we can offer on the spot. But just remember that you can always reach out at any point. I will share in the follow-up email Alzheimer's San Diego's contact information as well. So you'll have that readily available should you wish to contact them directly and have further conversations or check out their website and all of their amazing resources at hand. So I will be sure to send that in the follow-up email. And then here is ElderHelp's contact information. So if you're interested in checking out our website, our family caregiver courses, or a webinar library that has all of our previously recorded webinars included, feel free to check that out. It's elderhelpofsandiego.org, and under Solutions for Living, you would see our family caregiver support. So that is an easy way to access those, but feel free to reach out to us if you have any questions as well or need other support. But Jean, thank you so much for joining, and thank you all for tuning in. I hope this information was helpful for you and your families and anybody that you might care for or that you might work directly with. So we appreciate you learning more about how to have the conversation and how maybe to approach it in a different way. So thank you for that, and I wish you all a wonderful rest of your day.
Very good. Well, thank you very much, Carrie. And the same as you've just said, thanks to ElderHelp for having us. We regularly do these educational events with ElderHelp and really love to do that. So thanks again. And,
Our pleasure.
good day to everybody. Take care, everybody.
Thank you.